Welcome back to Oral Health and Medicine Separate Not Equal. In today's vlog, I'm going to be introducing the history of this division and how this issue came to my attention in the first place. You're not a doctor, you're a dentist. I've heard this line too often and it both frustrates and concerns me. The dental medical divide is rooted in both history and tradition. People used to go to barbers not only for a haircut but also for tooth extractions. For many years, barber and dentistry and even surgery coexisted, and it wasn't until the 1800s that they were separated as professions. Dentistry wasn't recognized when U.S. medical schools were being established. However, in 1840, the first dental college was opened and the dental profession started to really become a profession. Dentistry has always been and continues to be separate from the medical field in terms of the education system, medical records, and payment and insurance systems. Over the years, there have been questions raised about integrating oral health and overall health into the same system. However, there's actually been pushback from dentists who argue that they want to stay separate because of the professional independence of the private practice system. Although the split between medicine and dentistry is rooted in history and tradition, we must start to challenge this division and ask ourselves why we consider access to dental care and treatment to be less important than access to medical care. What tangible steps can we take to start integrating these two fields? Growing up with my dad, who's a pediatric dentist, I loved going to the dentist. It was my favorite place to go as a kid. Have other people brush your teeth, get a goodie bag filled with cool toothbrushes and different flavored toothpastes, and pick out prizes afterward. It wasn't until I got older that I realized not everyone enjoyed going to the dentist as much as I did, and I'm not talking about the kids. After coming into my dad's pediatric dental office for 6-month cleanings and checkups as well as working at his office over the years, I noticed that there always seemed to be problems related to dental insurance. I started to realize after talking with employees and hearing some parents arguing with front desk staff that insurance-related barriers were preventing them from giving their kids the treatment they needed. I remember a mom having to choose between performing 2 different procedures on her son, both equally important and necessary. I was shocked and frustrated when I heard that dental-related issues were not covered under medical insurance, even though oral health is directly related to general health. After hearing variations of this mother's story multiple times, I began looking into how this separation between medical and dental insurance affect others. In 2015, almost 35% of working-age American adults did not have dental insurance, while only about 12% of American adults under 65 did not have medical insurance in 2016. As people get older, it is more likely that they will suffer from dental problems, and a lack of proper and adequate insurance can contribute to more severe and potentially deadly consequences. This is only one instance illustrating the ramifications of this divide on families. This gap is hurting many communities, and we need to educate ourselves on the reasons that this issue has not been properly addressed.